Just to give a brief introduction, my name is Rachel. I'm a student nurse practitioner for the Psych NP program at Regis College, and this is a presentation of my major case study analysis for the NP program at the school. Just a brief introduction. This is a 72-year-old female that it's not a first time initial visit. I'm following her up after I was called upon. I'm going to pretend I'm the real nurse practitioner here. I was called upon because of a change in mental status. Because she is having weeping, worsening cognitive status, behaviors, and loss of appetite and weight loss over a period of 1 to 2 weeks. This is a patient who is a 72-year-old female, just moved in recently, a few months ago, to the dementia unit of an assisted living in Medway. And she actually is a former psych nurse practitioner, and she has a daughter also who is a nurse. The charge nurse called the office asking for a referral, asking actually to have this patient seen sooner than later at the request of her primary care physician, who she had just treated for a UTI and had just finished a course of her antibiotics. Thank you. Hi, my name is Rachel. I'm a nurse practitioner with Dr. Bruder's office. I'm here to see patient Mrs. JK. I'm speaking to the charge nurse. How are you today? Oh, okay. So I got information that patient JK has had a change in condition regarding her cognition. She is having increased weeping. If I may understand well, she's having increased weeping, loss of appetite, restlessness, anxiety. Can you tell me what's going on? Okay. I'm sorry to hear that she is, having such difficulty. Oh, she has just finished her antibiotic augmentin, right? Excellent. Oh, she's not eating well either. If I may understand well, you're telling me that your staff has had to increase the help that she needs, and now she's dependent for all her ADLs, as compared to when she actually was able to require supervision a few weeks ago. Is that true? Oh, that must be difficult. I'm sorry to hear that. Okay. Did you say her daughter is here? Okay, that's wonderful. It must be very difficult for her to watch her mother, go through this. How is her sleeping at night? Before I go to meet that patient and the daughter, I would like some collateral because, she's alert and oriented times self. She's been sleeping well. That's wonderful. What has she been doing for fun? Is she still going to activities? Because I know that last time I was here, she was still able to play bingo and engage, with her fellow patients in the living area. No longer able to do that. I'm sorry to hear that. That must be difficult. Okay. I'll review her medical record, her medication list after I meet with her. I would call the pharmacy for a med reconciliation list, and if there is anything else you need to tell me. We can circle back after I see the patient. Thank you. Okay. Thank you for walking me over to her room. Hello, Miss JK. Hi, is this Kim? Hello, Kim. I understand you're her daughter. How are you? Hello, JK. Hello, Jay. How are you? You look good. You feel good? Oh, you don't. I'm sorry to hear that. Okay. So, how are you feeling today? Okay. Kim, I know we've met before. And again, my name is Rachel. I'm the nurse practitioner. We had an appointment today. I just wanted to, kind of like, see what's going on. I'm glad you were able to make it today. What would you like to see as a goal of this visit today? Okay, you would like to see an improvement in symptoms. You'd like to see more engagement like how she was able to do, and you want your mother comfortable at the end of the day. Is that right? Okay. It must be very difficult for you, to be in such a situation, watching your mother, decline so fast. It must be difficult. Okay. I just wanted to let you know I use evidence-based practice. Also, this information is confidential, and if there is any form of report of self-harm or harming of others, then I have to report mandatorily. And I just want you to understand that. But this is free space. I just want you to feel comfortable to talk to me. I'm here for you, and I want to help as much as I can by working together. It must be very difficult for you to see your mother like this. Oh, you have noticed that she's speaking to herself, hallucinating, hearing voices. Do you find her distressed when she's talking to voices? Sometimes. Oh. I understand she's had a UTI and she just finished her antibiotics. Sometimes they take a while to clear, and it can be pretty serious, especially in the older population. However, it could also be a worsening of her cognitive, deficits, dementia. I know you want her comfortable. Okay. I'm going to review her medications after doing a complete assessment, and I'll definitely let you know. I'll follow up with a phone call to see how we can manage these symptoms. How is your support system? Because I know it is really hard to see your mother decline so fast. Oh, your husband is also supportive. Would you be interested in some resources? Okay. I do have some resources about the Alzheimer's Foundation for families, and the Alzheimer's Foundation. So I can give you that. Okay. Okay. You would also like to see your mom, play, bingo if she can. It must be hard. I understand they did start some physical therapy, but she was not able to follow through. Yes. If I understand well, just to talk back, is that you would like to see better function mobility if it is within the goals of care? Okay. Okay. It was a pleasure meeting you both. Let me circle back with a nurse, and then I'll follow up with a phone call. How does that sound? I also could make another follow-up visit in a week or two, and you can call me anytime as needed before then.